Shamim, thank you so much for joining us and congratulations on being a catalyst. You are someone who has been on the ground in your home country of Uganda. You've seen a problem, you have seen how it's impacted your community, and you've worked to fix it. And then as a result, you're really helping to change the world. So let's get to the problem you are trying to solve. You are entrepreneurial, you have several companies, but we want to talk about the work you're doing with Chill. Tell us about the problem that you are looking to fix and how you went about it.
I founded this company after the unbearable pain that I went through as a breast cancer patient. Can you imagine? Cancers are one of the leading causes of death in the whole world, and yet they're not given priority. In only 2020 alone, more than 9.9 million people died of cancers. And to breast cancer specifically, more than 2.2 million women suffered breast cancer. And of these, more than 685,000 women died of breast cancer. Breast cancer is the leading cause of cancer death in the whole world. And this is worse in the developing countries, and Africa especially. This is because people have to move long distances from their homes to the hospitals to acquire services. And even when they reach the hospitals, the services are really very expensive. So it is very difficult for someone to screen for cancers in time. And with the information barriers, this makes it hard for people to acquire these cancer screening services in time. And with this puts the survival rate at a very minimal rate. Because of the pain that I went through as a breast cancer patient, I saw very many people on the sick bed dying of the cancers. And with this, I founded the company Chill Eye Lab, which offers cancer-related services using the power of artificial intelligence, that is automation, referrals, and also interpretation of lab and radiology reports. We offer these services at an affordable rate. Yes, I know that I would have been able to employ so many doctors, I would have been able to start so many hospitals, but without the power of technology, this cannot be able to provide services to every woman out there. So with the use of the artificial intelligence that we offer automated related services to women, for example, a woman could come to the hospital and is having breast cancer and want to know the effects of the drug they are taking. Would they have to exactly move to the hospitals? No, they'll just have to use the technology and using our platform so that they can be able to acquire these services. So this is what I'm talking about, that everyone can be able to access the services anywhere at any time so that their lives can be improved. And that is what Chill AI does.
You know, we do know with cancer in general for the entire world that early screening and detection can really determine in a big way the outcome of an individual, their success rate in terms of getting beyond it. And so you really made it possible for people to get that screening. It's something we take for granted, right, in the developed world, but in the developing world or in your community, it wasn't so easy to do.
Unlike for the developed nations, where the acquisition of consulted services is at their doorsteps, people don't have to move long distances. This is so different in the developing nations, where people have to move kilometers and kilometers to acquire consulted services. And by the time they come, that means they have endured so much pain that the cancer is already in the advanced stages and there is less that can be done about it. And thus the survival rate is very low.
You know, and I don't know if our audience knows this, but some of the statistics, patients of African ancestry have the poorest outcome, the shortest survival rates from cancer globally. Breast cancer is the most commonly diagnosed cancer among African females. In sub-Saharan Africa, breast cancer deaths have increased 70% since 2000, and the 5-year survival rate is less than 40% versus 86% in the United States. Tell us about the impact that you're having and the difference that you've seen as a result of the work that you're doing with Chill.
At the beginning, it was very difficult to convince someone to come and carry breast cancer screening when they're not having any pain. Actually, I lost almost hope because the first 50,000 automated referrals that we carried out, of these 25% had advanced breast cancer. That meant that the survival rate was very low. With this, we added advocacy sensitization, that our team would sensitize people about the advantages of early cancer screening. And with this, there was an improvement because in 2019, of the 500,000 customers of the automated referrals that we made, of these 20% were found with advanced breast cancer, which was an improvement because at first, very many people were found with advanced breast cancer, but now the rate had reduced. What did I learn from this? That with increased sensitization and increased acquisition of services at people's doorsteps, the rate at which cancers are diagnosed at a late stage will be decreased, and thus this will increase the survival rate of the people.
Technology has made this possible. Tell us a little bit about the use of artificial intelligence and machine learning, tele-oncology, how the technology that you're using that makes this all possible.
I always tell those around me that technology is like a newborn baby. When a family gets a newborn baby, there is joy, and that is technology. Technology comes with improved efficiency. Technology comes with improved accessibility. Technology comes with improved privacy. Technology comes with less error.
So, Shamim, what is next for you? Is there a transformative innovation that's coming down the pipeline that you're looking forward to that can help you with the work you're doing at CHIL? What's next?
Yes, there is something new. In a few days from now, we shall be launching our new edition of a disabled being able to speak to a doctor. In this, a disabled person will be able to speak in sign language, and automatically it will be translated into audio, which will be understood by the doctor. And in the same way, the audio spoken by the doctor will automatically be translated into sign language so that the disabled can be able to understand. And with this, there will be proper communication between the doctor and the disabled.